Hello everyone, it's Tim Spector here of the Zoe COVID study. Many thanks to all of you for your kind wishes about my health after COVID and also my book Spoonfed. Very much appreciated. Now, I'm delighted to say that I am feeling better, but I did feel pretty rubbish, both with those cold-like symptoms at the beginning, runny nose, real bad fatigue, back pain and congestion. But the only lingering symptom after 2 weeks I've got now is actually sinus problems, which is probably nothing to do with COVID and just is something that I happened to get after a cold, and luckily haven't had for the last 3 years because colds have gone away, but I've been reminded of it. So back to business. As usual, we're going to be looking at the latest figures, and we're going to see about a drop in cases again, and how that varies depending on where you live. We're going to talk about the BA.2 Omicron subvariant and what's happening to that, and also a few more insights into metallic taste, which I know tickled your fancy last time, and also the rumours there are about the possible end of the ONS surveillance survey and a free lateral flow tests. So lots to discuss as usual. Let's get down to the data. So if we look at the number of new cases, we can see that it's about 181,000, which is an 11% decrease on last week. Again, quite a big drop. Things are really going up and down, as you can see from the graph. Clearly we're over that peak again, that second peak. And you might also notice this graph is looking a bit different to previous weeks because we've done away with the separate graphs for the unvaccinated and the vaccinated. It's very hard to find unvaccinated people who haven't already had infection, and therefore we thought it more practical and sensible to merge the figures as most of the other data sets have done and give you this combined result from now. It shouldn't really change any of the conclusions we reach. Now, levels are really high. I think that's the main thing we're seeing from this still. We estimate that 1 in 24 people currently have COVID, with the highest prevalence rates still in London, the southeast of England, and also the West Midlands. Now let's look at deaths, where we can also see that weekly averages are around 1,080, which is really, again, down considerably from last week by about 500. And as I've said before, these are probably overestimates because of the way we calculate deaths in the UK. Hospitalizations, again, it's good news. 1,305 people admitted to hospital with COVID. Again, only half of those are probably because of COVID. And that's back to pre-pandemic average rates of hospitalization. 393 on ventilators, which is a more precise measure of COVID. Again, that's down a small amount, 50 from last week, which is our best indicator of the severity of the disease. So these are really promising figures, which do help the government's point of view about loosening restrictions. However, it is too early to tell the effect of Omicron on long COVID and other things we're not yet sure about. And of course, other variants might be around the corner. But that is good news, which we need to embrace. Now let's look at different age groups. And we can see that the good news is that the kids and parental ages up to 54 are coming down. And they were the ones responsible, I think, for the recent double wave. And the other age groups, the elderly and those in their 20s and 30s, are pretty flat. And that's good news, and probably why we're not seeing major problems in the hospitals. Regionally, this really does depend where you live, what's going on. If you're within England, what the data is showing is that fairly consistent pattern. Rates are coming down all across the UK, as you can see from this map here. There aren't huge differences anymore between the English regions, and but when we look across the other parts of the UK, we get a different picture. And this graph here shows the really big changes happening in Northern Ireland. So thanks to our loyal supporters there for giving us this data. Big increases there, although it looks like it might be plateauing. And Scotland is also still going up in contrast to England and Wales. So different things are going to be happening at different times depending on where you are living. So the question I'm being asked a lot is how much of this is due to the new BA.2 subvariant of Omicron. We are still slightly in the dark because we don't have really powerful up-to-date data, but we're better than most countries. And what we're seeing is based from a mixture of data, a lot of it helped by Alistair Grant at the University of East Anglia, who's shared his data with us. And they show these graphs here where we can see in the southwest, the percentage of cases is above 50%. And in the northeast, it's less than 20%. So quite a big difference depending on where you live, mainly south to north. And that is likely to change. We can see also on this other plot where we've plotted the prevalence, how common the BA.2 variant is against the number of new cases, and there is a rough correlation. So the most number of cases have been in the southwest, southeast and London, and that so far has the highest prevalence of the new subvariant. So association doesn't mean causation, but it's still quite possible that this is a factor in what's happening because of the greater infectivity of the new one. Makes it really hard to stop. We are still finding out about BA.2, but we do know its doubling time seems to be around every 7 or 8 days, and it's affecting a third of the population at the moment. And we believe its advantage is because it has a slightly shorter incubation period. It may be just 3 for BA.1 and 2.7 or so for BA.2. A subtle difference in that can make a big difference in how infectious it is in sweeping through households and schools, etc. Now let's talk about some of the other surveillance surveys, particularly the ONS survey, because it's been rumoured this week that the government is about to pull the plug on that study. And I just wanted to talk a little bit about that, because the ONS surveillance study, where people are selected on their homes, they're paid some money to be swabbed, and those data are collected by thousands of people, has provided amazing service for this country over the last year and a half. And it has provided us with really useful data across the pandemic for not only incidence data, but also data on antibody status and many other factors. And it'd be sad to see this going as the government diverts funds to other areas, if that is true, because the rest of the world actually envy us these important epidemiological tools, so we actually find out what's going on. And I believe even if that got closed down and the Zoe one stayed, we would be lacking something, because it's very important to have multiple methods looking at the same study to be sure we know what's going on. However, I think let's look at the graph of how we've done, and we can see that the Zoe study that you contribute to has really mirrored very much this the ONS surveillance study, with a few exceptions. And we can see in the last month they were estimating higher numbers than us, and were slower in showing the reductions, and then slower in showing that second peak again, and now falling slightly faster. But looking currently, the confidence limits overlap each other. So I think given the different methodologies, they're incredibly similar and showing a broadly very similar picture that things are now improving. But the fact that our data have been so consistent is all thanks to all your loyal contributors who are tracking this at a mere fraction of the cost of that study. We think maybe around 1% of it. So that's pretty amazing. And the methodology of the Zoe COVID study and it's because it's self-selecting and you guys decide whether you want to send your results or not, we're not paying you or threatening you, has been disregarded by some groups and media outlets that I won't name as not representative, and therefore they don't trust it. But due to our scale and the fact that we've been tracking the ONS systematic survey through this time at far less cost, I think is testament to how good the system works and how good a team we're all making. And I think it's something we should all be really proud of. Of course, we don't know if our funding is going to be renewed either, but I think we've built an app that is future-proofed and exciting to see where this would go, not just with COVID, but also with tracking other disease and health conditions long after this pandemic is over. So let's look internationally. I think in terms of case numbers, as we've discussed, they're really high everywhere, and I think every country is recording them differently, and even the UK results are no longer reliable, so I don't think we should look at those comparisons anymore. But if we look at hospital admissions, we can see quite big differences between countries, and Denmark, which has the highest rate of BA.2, we think, does seem to be still heading upwards, although it seems to be plateauing. Other countries are generally coming down, and I think that's good news. So most countries are not showing an increase in hospitalizations, and that is really good news. When we look at the ICU cases, we see a similar picture. No countries currently going up, and again, that is excellent news for the future. Now, let's talk briefly about getting rid of lateral flow tests, because that's another rumour that's been circulating that this country, which provides free lateral flow tests, unlike, I should say, most countries in the world, a few of them have exceptions. Most of them you've got to buy them at around £5 or £6 a go if you want to do that. And a lot of people think this is going to happen, and I think they became a critical tool the UK had in tracking, identifying cases in the population when it took hold in December as we were phasing out the PCR tests. But people argue that lateral flow tests haven't actually changed the number of cases or the number of admissions because the countries that didn't use them. So I think there's a difference between the good it's doing the population and the good it's doing individuals. Certainly it's quite useful as individuals to look at lateral flow tests, but as we've seen, there are some false negatives, and so people have had cold-like symptoms, got a negative lateral flow test, gone and met friends and found out later they were positive. So they're not infallible, and I think we should perhaps use them with a little bit more caution than we are. In terms of you loggers on the app, I'm making an exception. I do want you to keep using them and logging them so we can really keep an eye on this pandemic, and really important to log those negative ones as well. Now, looking at symptoms now, 682 days since we started pestering the government about this, and classic symptoms keep getting less common. Problem is, institutions like hospitals, care homes, dentists are screening people at the door only for the classic symptoms. They're not asking whether you've had cold-like symptoms, which is madness. That's my main problem with this at the moment. Let's look at the top 20 symptoms. Not much change in the running order here. Runny nose, currently number 1, and we're seeing sore throat is nearly 64%. That's nearly 2/3 of people now have sore throat than they did. And back pain, which we talked about in the past, is still in a minority of people, only about 18%, but makes the top 20. We've been looking across the regions to see if there's any difference in symptoms between those with the high BA.2 Omicron and those with the low. So far, nothing major has come up, but we're continuing to have a look at this more closely. And there are other things about this new variant that we need to be looking at. How come it's 30% more infectious? Could it be causing things like sneezing more or whatever? We don't know. So we're going to keep a close eye on that. Or it just could be the fact that it transmits in less time. Its incubation period is shorter. Now, metallic taste is something we discussed last week. We're continuing to look at it. Got lots of interesting comments on the video that put onto YouTube. And you can see that, but an update on that is we divided all the 5,000 odd people who reported metallic taste following the vaccine into a group that only had it in the first 24 hours, because we think that's the key time when metallic taste is most likely to link to getting some of the vaccine into the blood vessels, in theory. 18% did that, so we've still got a reasonable sample, and you can see that many people reported metallic taste sometime after, which is probably going to be different reasons. Now, we're not able to get to the first hour in time, but we're assuming that a number of people in that first 24 hours had it immediately after the vaccine. And so looking at that group, if there was something worrying about that first 24 hours, they should be showing more symptoms or more risk profile than people who had it later. And I can say that when we look at this graph between those in the first 24 hours and those who have at any point several days later, there was no difference in the percentage of people with really bad systemic side effects in the next week or two. So that's good news if you've had a metallic taste in the mouth. It doesn't tell us whether those 1% of people, is now quite a small portion, have really rare side effects, because they would only occur, as my friend John Campbell has pointed out in his videos, at about a rate of about 4 per million vaccines, which is tiny. But what we're saying is that metallic taste itself shouldn't give you particular cause for alarm. If anything does occur, it's incredibly rare. Now, it doesn't mean that we shouldn't be still considering aspiration at vaccine when you have your vaccine, to make sure it isn't in a blood vessel. And many countries like Denmark are now doing that to reduce those incredibly rare events of 1 in a million or 4 in a million that may cause blood clots or some immune reactions. We'll continue to look at these adverse side effects and reassure you about this. And this is the first ever study, I think, on metallic taste, and just shows the power of the app and you guys giving us this amazing data. But 85% of people with metallic taste in the first 24 hours after a vaccine have no adverse effects at all, even mild ones. So not really something to concern most of you. Now, let's talk about the diet study update. We are rolling out this health profile gradually to all of you, and this is giving us lots of information about all these diseases you've been logging. And you may remember we did give you a questionnaire on diets and supplements. And I think something we haven't discussed recently is the interesting fact that over the pandemic, your use of supplements has actually increased quite a lot. So people obviously believe that taking supplements is going to help ward off the worst effects of COVID. And a lot of that is marketing and also word of mouth and social media. We found in the study of 1 million of you that there was absolutely no effect of vitamin C, garlic supplements or zinc supplements on your risk of COVID-19 or having severe disease. In terms of multivitamins, vitamin D, omega-3 and probiotics, we showed no effect at all in men and a slight increase in women only. And probiotics was the one that had the biggest side effect, but generally we're talking and the range of around 9% for these. So it's pretty small and inconsistent. And I think the idea that we all like a quick fix solution is definitely there. And I don't think there's any great rationale why this should only affect women. So the best way to support yourself against getting more severe Omicron is definitely through improving the quality of your diet, having more plants and vegetables, more fermented food, rather than relying on one of these supplements. And you can get vitamin D from all kinds of plants, mushrooms, and importantly, if you get a chance, sunlight. So to round up, cases are still really high. They are dropping in most parts of the UK, but not all. And it's still relatively mild, keeping people out of hospital. But with restrictions likely to be blown away very soon, and isolation rules in particular, I just wanted to discuss what we should all be doing really to be responsible and be safe. And I think in my personal opinion, the best thing as an individual you can do to protect yourself is to buy a good quality FFP2 or FFP3 mask, which we do know does protect you to some extent from virus. It will reduce your risk, and other types of masks really with Omicron seem to be of very little benefit. It's also crucial, I think, that we act responsibly for others. So what can we do for the community, the population? I think the best thing to do is to still enforce our own isolation rules. And I would suggest a pragmatic middle ground, even if there's no testing, is 5 days from your first symptoms. Just stay by yourself and don't go to work, don't infect friends and family if you can. After that time, the risk of transmission is very much reduced, and that might be the way we can both live with this virus and carry on having a relatively normal existence, because it's not going to go away anytime soon. It's going to be here for the rest of this year. And although I'm testing negative now, I'm still reporting all my symptoms on the app, and it's really crucial for our scientific research. So please do the same for us. And we still need to find out about long COVID, long-term symptoms that may be a problem we're still unaware of. So do keep logging whether you're infected or not. Please remember to like and subscribe our channel, share the app with those that have dropped off, keep an eye on our website and app for other details, and stay safe and keep logging.